500 and something. Is she?
Yeah, well, no, I'm in the stands praying for her. I don't know, but at home, if that happens, she's real thirsty. She has a headache.
Yeah,
she
yeah,
feels bad.
yeah, yeah.
Pushing
Of course,
through
the excitement of a game
yeah.
kind of keeps that
Another
stimulated.
little thing, I don't want to hog the time, I'll say it really quick, but when, you know, as a parent, when your child has something, you rack your brain to figure out, like, the world, and did I do something?
Yeah.
I drank too many Cokes when I was pregnant, whatever, you know, you do all this stuff, but the thing that doctors have grabbed onto with us is we've done quite a bit of the research, Andrew, they're always asking us to, so on my side of the family, and on my husband's side of the family, both of our mothers and both of our sisters have had all kinds of thyroid issues, just create all kinds of thyroid issues. I don't have any. And my grandmother did too, so my mom's mother, so on all of those sides. And so we have 2 boys and 2 girls. My husband and I, so two girls. Olivia was type 1, diagnosed at age 6, and Shelby has a hyper, you know, for an adult they call it, Hashimoto's, but they don't, she just has high level of antibodies. So it's just interesting.
It sure
she
is.
sees the same doctor Olivia does, and you know.
So you really wonder about the endocrine system in your
Yeah.
family.
So we have autoimmune, like I have a few little autoimmune, it's not a big deal, but the girls, but it's on both sides of our family. That thyroid. So that's the only thing that doctors have.
It really does make it seem genetic tendency. Yeah. Oh, thank you. Yeah, anybody that has anything add, do. That's interesting. All right, let's go back up to the third one, Caldolor. It's IV ibuprofen. When it first came out, hold your finger there and then go to, still this right here, but I want you to go over to IV on page 20, about midway. Ofirmev is IV Tylenol. When they came out, people really said it was great. The little bag piggybacked in, and I'm not saying it isn't great. I don't know why it didn't take, because it hasn't. And nurses, when it was done, it was a pilot, and nurses raved about it. They said, you know, that IV ibuprofen is quick, and now, of course, the Tylenol, Ofirmev, doesn't do it's not anti-inflammatory, but for analgesic, they said it was as good as a narcotic, that IV. I'm just telling you, it's out there. It's expensive. Now, that may be, but we use a lot of expensive. Narcotics are too. So don't give me that that's the reason we're not using it. Do what? I bet you're right. Won't pay for it. Look at this bill on Tylenol and ibuprofen. Really? Well, it's IV. Well, they don't need to be doing it. I bet you're exactly right, Kathy. Okay, and so then go Carafate, and we already talked about that. That causes the food ball, aka Bezor. And if you're not better in 6 weeks, it needs to be stopped. And I think I told you, it's like a coating over the sore, but you get absorption of nutrition through it. Catapress is just, it's clonidine, which is for blood pressure, of course. Cipro, and there it is, for methicillin-resistant Staphylococcus aureus. Cipro. Avoid drinking or eating yogurt or milk at the exact time. You can wait 4 hours and have your milk product. If it's IV, it won't mix with any, you don't give it IV and let it touch any other medicine. Now, colony stimulating factor, Neupogen, Numega, and Epogen. So hold your finger there and go to the ends. Well, let's go to E first, Epogen. Next page, 18, middle of the page, Epigen. It increases RBCs, erythropoietin, aka Procrit, sub-Q, about $600 a shot, and it stimulates bone marrow to produce red cells. Erythro means red in Greek, erythro, so red cells. Now let's go on to the ends for Neupogen and Numega. Neupogen on page 20, about a fourth of a way, and it's the same thing, sub-Q, increases platelets. And then Neupogen increases white blood cells, which fight, they help, stimulates neutrophils, we'll talk about that later, to differentiate and mature. Gives slowly sub-Q, aka it's called GSCF as well, growth stimulating colony hormone. And if you've watched, some of you have watched the hematology film, it very much discusses that the bone marrow gives us our three blood cells, red, white, and platelets, and then plasma. And so these sub-Qs will stimulate the marrow to put out more of them. We give it a lot on my floor because chemo has burned the marrow trying to kill cancer cells. And so they want to try to stimulate them to get back right. Corticosteroid inhaler, and we talked about you stay away from cortisol if you can, because it slows healing and retards growth. So, but it's anti-inflammatory, and that's a beautiful thing if you're all messed up congestive-wise. So there are 2 or 3 of the cortisol steroid inhalers. But, as we've already said, it may make you hyperglycemic because it's steroids. And then corticosteroid nasal, there's some right there. The nasal that aren't inhalers, they're just. And I think it's interesting. It should really help you within 5 minutes. Now, corticosporum, ophthalmic or optic, and you can use eye drops in the ears, but not eardrops in the eyes, and I think we all remember that. I do not know, I wish I knew, why wicks, the little cotton thread that you put in the ear, and you put the drops in, and it swells. The wick swells up and touches all the ear. And then if you keep putting drops in, then that just absorbs better. And it's never, if you ask me, now I'm not a pediatric nurse, it's never caught on very well. It just isn't done. Doesn't it sound good? Keep a wick in there, or a swollen cotton, and keep putting the drops on it, and it absorbs better. Or put a new one in. But it just, put the wick in the ear, apply the whatever, antibiotic, whatever. Expands to fit the canal. So you've got the whole canal fitted, not just put in the drops and then they sit up and it all pours out. I'm just amazed. Keep in canal a few days if you want to swap it out. Apply drops to the wick. But after infection runs its course, hydrogen peroxide is such a great cleanser. Now, put that in there and do your cleansing. It's a good thing. Coumadin, still around, granddaddy of anticoagulants. Best to give it same time each day, according to the some hospitals 5 in the afternoon, some at noon, whatever. Anticoagulant. And cyclosporin, and if you gave that, you'd probably read about it and be on top of it. It's given for rejection in transplants. And CMV, the cytomegalovirus. Give in glass or metal, not plastic. And if capsule, open the capsule, mix with the PDR or the pharmacological places say pineapple juice is better for this than orange, but orange is acceptable to deaden the taste. Can be given IV, but is made differently, and the shelf life is 6 hours for a bag and 12 hours for a bottle. Cymbalta is antidepressant, pretty popular, and Dakin's solution is like Clorox. It's a diluted 5% Clorox. That's not much, but it's enough for a smell. And it's a good cleansing. A lot of times wet to dry dressings are done with Dakin's.
I can just read that and smell it.
Huh?
I can just read that and
Yeah,
smell it.
can't you? Uh-huh.
I remember it.
Yeah, yeah. Listen, and this is a good time, and I may repeat myself, so just humor me, because you know I've got another group I talk to, and I kind of forget. I try to keep mental, but I'm going to mention wet to dry right there. See, the whole idea, sometimes we use saline for wet to dry dressing, sometimes Dakin's, and no matter how big or little, the whole idea is to stuff, really stuff, and so that when it dries and the next person needs to change that dressing, they pull it out and it debris. And one of the worst things nurses do is lubricate it with saline so it won't hurt when it pulls out. Well, you're not debrising it. It needs to hurt. It needs to bleed. That's bringing the blood to the surface. And how many times patients will say to me, now, I wish you'd put something in there. This night nurse pulls it up, puts a lot of stuff and pulls it out. And I put my finger in their face and tell her she's doing it wrong and correct her next time. No, not quite that bad. But the whole point is I want it to bleed when I pull that old dressing out, because that's bringing blood there that's going to heal. And I just don't think nurses quite put that together. So we'll use all those things. Dakin's, saline, peroxide too. Well, peroxide's a little caustic and toxic, so we don't really soak that. Really saline and Dakin's. And then some of the other pharmacologicals that they've gotten to the physician with, the companies that say it's so good. Now, with that being said, that wound that you're packing will heal from the inside out if done right, and it may take a long time. Home health may be having to go twice a day, but it will if done right. And so often, if the physician sewed a wound, sewed it up with stitches, and this morning you're ordered to DC the stitches, sutures, whatever, and you do, it looks a little angry. If it's angry at the incision site, give a little pressure, and if purulence comes up, we need to get it cut. I mean, the sutures have got to come out, and then, you know, sometimes you take one or two and then it just pops open, and there you've got your purulence, which means now they have just eased into a candidacy of wet to dry because they can't do it again. We've got to go now from the inside out and go on and put a sterile glove. If it's big enough to pack, put a sterile glove in and pack it under the lip, every dimple, and get that wet to dry there so it will dry, and debris it so it'll stimulate and maybe bleed. If it's so tiny, oh, it's just this big, then I have got to get a Q-tip that don't use the cotton part of a Q-tip, but the wooden or cardboard part of the Q-tip. And if I'm going to stuff with some stuffing, they've asked, what's the one they love? Iode form, or some of those medicated ribbons that are in jars. Then you take it and stuff it with the wood part or the cardboard part of a Q-tip as far down as you can go where you hit bottom. Because if you don't, you leave that little pocket that's going to get purulent and won't heal. So I just feel real strongly about good care of a wet to dry or inside out dressing. But then, that's old timey. We still do it, because it's foolproof if you do it right. I think it's enormously expensive. The supplies, stuffing and ABD on top, and then we do it 4 times a day and all that. But, and I lose track of time, but it's been about 20 years at least that they say Russia came up with it, that the wound vac, and that comes in a tray. And I promise if you see one, you can do one and then teach one. And you can probably do it with just me telling you. The wound vac tray comes, and then the machine comes. But the wound vac tray gives you something to wipe your area, and then a piece of sponge that you will cut to fit your wound. Now, your wound is not always beautiful and round, but that's fine. You just cut. They give the scissors in there. You cut the sponge pieces, just like a puzzle. You're doing a puzzle. This wound has a little tentacle out that way. Then get some of that sponge and just put it there. You don't have to stuff it. Just lay it on there. Just lay. And sometimes that area is just nothing but bits and pieces of the sponge that you have cut and placed. Now, you haven't stuffed it. You just put it on top. Then on the tray next, and they have it in layers, is the opsite or what's the other name? The opsite, tegaderm, big usually. If you want to cut it, you can. And now you've just put it over your sponge, and you don't have to put your foot on it to press it down and all that stuff. The machine came up with all this, and it has a tube. So put the tube under the opsite anywhere you want to. Here was your opsite, and I just made a place for the tube. And the tube now leads to the machine that's going to suck. And it goes at the foot of the bed. So it's now attached. And as soon as you turn it on, it goes. And that takes all the air out. Your sponge, it's usually gray. It looks like gangrene, shriveled, because the opsite shriveled, and now you have a little spot because they pushed all the air out. But the machine is stimulating, and it is doing and you keep it on. Usually it's 3 days before it starts leaking, because it will, it break, especially if you've got another wound nearby. But the machine it's pulling fluid out of there if it's purulent. Sometimes it's not purulent, but it is stimulating and bringing fluid out to the machine, and you're just going to measure. You don't have to empty the machine. It's like the Plurivac. Just make a mark and note how much drainage, and you usually don't get a lot. It's more the stimulation, and that's called the wound vac. Let's see if that's under equipment, maybe. What page is equipment on? Jonna, what page?
Is it in 11?
Huh?
10 and 11?
10 and 11. Go to briefs, 10 and 11. Do you see wound vac? No, I don't. Okay, so go to data. Let's look at that. I just want to see what I said. 7 and 9, 7 and 9. Let's see, I bet it's not on there. So our last one will be terms. So now go to terms, 25 to 27. In the brief still. Oh, I know it's in here, sure. It's not, is it? It may not be. I thought it was. But that's your wound vac, wound evacuation. And it's doing, really kind of doing what the wet to dry did. It stimulates. When you and I stuffed the wet to dry, we were stimulating. And then when we debrided, we were stimulating. But this machine is doing it by suctioning. On and off, it's doing the stimulating. It's been out 20 years or so. They say the Russians figured it out. And then we picked it up. But it's a great, and I've done a lot of recommending, and I don't know that doctors, you know, they don't, some don't stay up, but I knew a friend who kept rejecting her implant, breast implant. I think it was cancer. She didn't just do it for looks, but it kept rejecting, and it was a mess. It was gangrenous and everything. And we were stuffing her 4 times a day. And it's such a slow process. That's something you need to, home health needs to be doing it there. So they go home. And I told her, I said, have y'all discussed a wound vac? She said, I did. He wasn't interested. Oh, really? Then he'd get interested. Come on. A wound vac would have, she did. She insisted because she was a nurse. But you know, you back off. And she did great.
How much longer does it heal using the wound vac than having a packet?
I'm not sure it's enormously dramatic, but I think it would at least half time.
After I had my daughter, I had so much edema in my skin when they did my cesarean. They stapled it together, and I got a huge hematoma, like this big underneath it. So they had to open it up and get that out, and they had to leave it open. And it took over a month.
It takes forever. Yes, and it was wet to dry. Yeah.
Just stuffing like a whole thing, a whole roll of gauze at first.
Oh yeah, yeah. It is the slowest, and people get discouraged, and you just can't. It is foolproof if you continue to do it right. But yes, that's a great question, Brooke. How?
If it shortens the time, I would definitely rather have that, because I couldn't even do it myself at first because it made me sick. I wasn't a nurse at the time.
Yeah. Yeah.
And so my mom would
Did
do
it.
it
Yeah.
for me, and then finally
It takes
eventually
forever.
I should do it.
Yeah. I'd say halftime at least. Well, you think about it. It's stimulating, pulsating.
Does St. Thomas have a wound care nurse?
Uh-huh.
Wound care
A lot of places do
They
have a
usually
wound.
don't recommend or they'll order the wound vac.
Huh?
They don't need a physician to do it. They
That's
do
right.
it.
Yeah, you're right. Centennial, they've got a wound vac group that go hospital to hospital. And I'm sure Ascension probably does too. Yeah, good. All right. Now wait a minute. We're back at 17. Aren't we about through with that page? I'm really tired of that page. Dakins. Well, I got off track, didn't I? Let's go one more page here. DDAVP. I think I've already mentioned to y'all. That's your anti-diuretic hormone. Going to talk about it more if you watch the Endocrine movie or YouTube. I'll talk about it more. Demerol given sometimes for chills. Desferol, like DE, dehydration is take fluid out. Well, this is DE, ferrous, get the iron out. Extract serum iron. um, and used in patients getting too many transfusions. You know, iron reuses and reuses and reuses. So if you get transfusions, you're getting a lot of excess iron, and that isn't good. Dilantin, and I think I've told you all to remember DDD. Don't mix dextrose and Dilantin. Dilantin just needs to touch saline. Dilaudid is hydromorphone. Dopamine, if micrograms, the real statement, everybody loves to blow away. How many mics are on 3? 3 mics, 4 mics, 5. Well, what they're really avoiding telling you, which is fine, they're just shortcutting it, it's 3 mics per kilogram per minute when anybody spills that off. So you've got to know their weight per kilograms. And if it's 3, less than 3, they're doing it for renal difficulties. More than 3 is probably heart. So it's just kind of a little thing to keep in mind on dopamine. Doxadan and Colase still being used. They're old. You can warm them in a microwave, but not too long if giving in a feeding tube. Doxycycline is vibromycin, and it's photosensitive, so it's usually in a little brown bag.
From personal experience, it is so sickening on an empty stomach.
Oh, really?
Oh my gosh, I went to the emergency room because of it. I took Dr. oral doxycycline on an empty stomach, and I drank it with water, and I ended up 30 minutes later in a situation I can't even remember because of eating that.
And what would you say is good to take with it?
I would just take it with food.
With just food? With doxycycline to take food is what we're saying, Megan.
So definitely take with food.
That's good. Thank you for sharing that. Eliquis, we've already talked about. It's one of those that have come out since Coumadin that you don't have to have your blood tests so often. TB loves that one too. There's your Epigen. Iron, just remember that makes you constipated and tarry stools. And then do keep in mind that iron, if you're going to take supplemental iron, if you are doing public health and are recommending that they do vitamin C with it. Vitamin C gives it that boost. You still get iron without vitamin C, but it just gives it a better punch. Vitamin C doesn't need iron, but iron needs vitamin C, or does better with it. Gamma globulin is an antibody, and I want you to, so what? Well, antibodies fight. Antigen, because I'm going to talk to you on the immune system. And the immune system is an antigen that I call a foreign product, or your body perceives foreign. It might be autoimmune, but your body has mixed up and thinks whatever's going on is foreign to you and starts fighting it. And so it's an antigen, and the body wants to make an antibody to fight it. So antibodies have been made to fight something. We have antibodies already in a medicine and give an antibody, like the horse serum, the tetanus antibody. Or gamma globulin is an antibody. We make them ourselves, but we might need some help from the pharmacological group. Gandrosin is sulfur. It's anti-infective. It's not an antibiotic, but it makes the milieu, it makes the surrounding area that life cannot extend. Heparin for a prophylactic dose is 5,000 units a milliliter. And we have a lot of new anticoagulant injections for prophylaxis. Lovenox, several that are out there. They all are doing the same type thing. the heparin drip. And let me just say, this is standard pretty much now. 25,000 units is put in a 250 milliliter bag, and that's made in, that's pharmacologically made. The company sends it to us. And it might differ from facility, but that's pretty much the standard. And the physician orders units an hour. And so a nurse has to calculate how many units in that bag. Well, you can do it yourself. How many units are in a milliliter? 100. In that bag, 100 units is a milliliter. So if the physician says start them off with 1,800 units an hour, it would be 18 milliliters on your pump. And then every 6, the physician asks us to look at the PTT, the prothrombin time, or the PTT, or whatever, and then up and down by units. They don't just, in the old days they'd say if it's this and this, go up 5 or whatever units, or 5 milliliters. We have to do the math now by what his cookbook, his or her cookbook. If it's within this range, stop it. If it's this range for PTT, up at 200 units, it's 2 cc's, 2 milliliters. So I have one on the floor tomorrow that I'll show you. Heplock is a solution of heparin and sodium chloride, and look how diluted it is, 100 units a milliliter. And that's for leaving in a central line when it's not flowing. When I first nursed, if we de-seed the fluid and just left the IV, we put Heplock in it, the 100 units. But we don't now. They've decided that peripherally, so it clots a little bit. It's all right for you to push that clot off. It's just on the tip end of a needle. It's not going to give you an infarct. And so they let us put our foot on the plunger for peripheral. But now for central lines, most of them, they do want the Heplock. This Middle Tennessee, we don't Heplock a PIC, a peripherally inserted central line, not peripheral, but peripherally inserted, and it's usually in the arm. And that one, they say it's not necessary to use heparin. I was so scared. I thought the heparin would eat the polyethylene, but it doesn't. I've been told since. It's not necessary. Why put even diluted heparin in somebody if they don't need it? And so it's not that it's going to kill them in a PIC to keep it patent with Heplock. It's just not necessary. But we're going to go over that March 3rd too, with IV stuff. Imuran is the most powerful immunosuppressant if somebody had an organ transplant. And then Inferon is an injection of iron, IM, Z-track, so that iron does not seep out. Iron's very caustic to tissue and vein. An oily injection can also be given Z-track as well to prevent oily med from retracting back out of the skin. This method of injection can be a nurse-independent action. And I want to speak to that just a minute. The Z-track is, I always thought it seemed like such a big deal, and it's just not. It's just pushing. If you can get a patient in any position you want to, if you want them on their side, at the iliac crest, just push your hand down, give them the injection, come out, and just at the last minute when you come out, put it back. That's your Z. And it's to seal it. And you can do it. I had a neighbor that wanted estrogen. Is that right? Yeah, it's oily. I didn't realize estrogen was so oily. And I think I just gave it to her. I don't know where I gave it, but I noticed immediately when I came out, the oil came out too, because it's oily and it just followed the track. And that's when I didn't tell her, oh, well, most of it came out. I didn't say, not so good job done. But I remember the next week or month, whenever she had me do it, I had already decided I'd do it Z. And that's just push tissue over, give it. You don't need to aspirate, because if you've pushed over, you're down in the muscle. So push over, give it. Just as the last second when you come out, seal it back. And that's why it's saying iron will make a tattoo, a little dot, when it comes out. Iron sure doesn't need to be aspirated, because it's dark and you wouldn't know if you're in a blood vessel or not. You know, aspiration is simply to keep it IM or from being sub-Q or being IV is the only reason you're aspirating. They say now you don't even have to aspirate. And that's probably true, because I don't know, maybe one time in 50 years I've gotten any blood when I aspirate. And all you do is just ease the needle back out of that vein and give it. So there's no, and actually they're telling us now to not even aspirate sub-Qs, because if you've pinched up, and that's usually what they want us to do, is pinch up. Give it with the pinch still pinched. Give it, come on out, just barely wipe it. You don't want to rub it, because the whole point is it's slow absorption with sub-Q. And so if you've pinched, you're not in an artery or a, so they say you don't even have to. Yeah. So I don't. You'd think I'd still do it, you know, being old, but I don't. All right, 19, and I know we're going to quit on meds, but these are going to be our insulins. So it wouldn't hurt you to keep that kind of sticking out the top when we go to our next things. Now, why don't you take just a little quick break,